Our study suggests that adopting a Mediterranean lifestyle that includes not only diet, but also adequate rest, conviviality, physical activity, social connections, adapted to the local characteristics of non-Mediterranean populations is possible and can be part of a healthy lifestyle. Indeed, we found an association with lower mortality risk. This is Mercedes Sotos Prieto. I am a nutrition epidemiologist at the University Autonomous of Madrid, Spain, and an adjunct professor at Harvard School of Public Health. And the title of our investigation is Association of a Mediterranean Lifestyle with All-Cause and Cause-Specific Mortality, a prospective study from the UK Biobank, published in Mayo Clinic. And I think this is important because it means that the non-Mediterranean populations, a healthy lifestyle pattern with proven health benefits could be adapted by other settings considering their cultural characteristics. Basically, what we did in this study was to study 110,799 individuals aged 40 to 74 years old from the UK Biobank cohort that at the beginning were free of cardiovascular disease, cancer between 2009 and 2012, and were followed up during a median follow-up more or less of 9 years. So what we found was that in this study of middle-aged and older adults, a higher adherence to the Mediterranean lifestyle that was called MedLife Index was associated with a 29% lower risk of all-cause and 28% lower risk of cancer mortality compared with the lowest adherent. And this study adds also to the literature that beyond diet, other components of the Mediterranean lifestyle can play a combined and a stronger role in the risk of mortality, cancer and CVD, not only in Mediterranean countries, but also in non-Mediterranean. So in addition, in our study, we found that the 3 blocks included in the MedLife Index were independently associated with lower all-cause and cancer mortality. But only block 3, that was physical activity, rest, social habits, and conviviality, was associated with CVD death and was the most strongly associated with all 3 outcomes. In addition, within this block, we found that participating in collective sport, limiting sedentary activities, or having adequate hours of sleep were associated with lower overall and cancer mortality. Of note, to say that we found that napping was associated with higher risk of all-cause and CVD death, but the siesta, that is an afternoon brief nap that is traditional habit in Mediterranean countries, in previous study, we found that a G-shaped relationship with lower incidence CVD. In the UK Biobank, we did not have detailed information on frequency and duration of nap and sleep structure. So we think that reverse causation was also possible with people napping because of subclinical conditions or other chronic diseases. And also, we also try to study that in this specific population, napping faces a stigma. But in this sense, more research is needed. The transferability of this study is important because it recognizes that each country has its local habits, food consumption, and thus food patterns should be culturally adapted to ensure both that is accepted by the population and that it is feasible within the existing food market. Our study makes an important addition to the literature showing that this adherence to the Mediterranean diet based on locally available products was associated with lower all-cause and cancer mortality. Furthermore, the overall Mediterranean way of life was also strongly protective of such outcomes. So again, understanding how to culturally adapt the Mediterranean diet to make it more appealing and practical for diverse population is important for participants, for patients living there. So this involves considering also local culinary traditions and food preferences, and also, for example, affordability. That is also a question. And finally, just to say that future studies may also assess the association of this MedLife Index that assess the adherence to a Mediterranean lifestyle with other outcomes in non-Mediterranean countries that could be relevant for the prevention of chronic disease, let's say frailty, for example, diabetes, or CVD incidents. And please feel free to read more details about this study in our article, which title is Association of Mediterranean Lifestyle with All-Cause and Cause-Specific Mortality, a prospective study from the UK Biobank.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.